And what is the pathogen economy? The pathogen economy is or exists to support and coordinate research, development, and commercialization of response tools to health threats. Omulimo gwaffe omukulu mu ofiisi y'omukulembeze kukwanaganya, kuvujjirira n'okulaba nga tutumbula eddagala n'ebikozesebwa ebirala nga vaccine n'ebikebezebwa. Ffenna wano nsuubira twali tukebereddwako, oba okebereddwa musujja, oba lukonvuba, oba siriimu, oba abakyala embuto, ako ka test ketukola ketuyita HCG. Jukira twalina lockdown. Abamu bakwatiddwa n'eyo nga tasobola na kusala bisaawe bya nnyonyi okujja okukomawo mu ggwanga. Abalala oba obeera bukwo naye lockdown yakusanga kadama nekikunyweza, oba oliwo emanaafa lockdown nga yakusanga butebo nekikunywerezaayo. Kati ebiseera byali bizibu, twali twetaaga bannasayansi, twali twetaaga banaakola vaccine, twali twetaaga banaakola eddagala, naye nga buli omwaka akwatiriddwa gyali olwa lockdown. N'ensi lockdown yokka, naye n'entambula ey'omu bbanga ey'ennyonyi wadde n'emmeeri era nazo zaafuna obuzibu. So kiki kye twakola? Twakozesa emitimbagano, ng'oli Canada, ng'oli Kapchorwa, ng'oli Kabaale, ng'oli n'Embale wano, ne tukola ze twayita Zoom meeting. Zaali ndooza nga 5, naye nga omwana omunnayuganda, baprofesa, badokita, abamu ku mmwe ba Herbalists ne mwegattiramu ne tulaba nga tuyiiya ebintu ebinaalwanyisa COVID-19. Era tubeebaza ku lwekyo, mwebalire ddala. Kati munnange ne tutambuza era ne tutambuza. Laba wuuyo tuyina ennyinyi tuzze era COVID-19 ne tumukolera ki? Eddagala. Era abamu ku bannasayansi ne ba Herbalists abaateekamu omulimu kyekyo kye kino ky'okutteko olwaleero kye tuyita tazikoovu. Waliwo eddagala eddala, thank you, era erya Covidex n'eddagala eddala. Era okwongera okulaga bye twakola, ne tukolayo ne vaccines ezo 3 ezigema. Kuno kujjanjaba, vaccine zigema, buli obukebera bu diagnostic kits bwakukebera. Kyekyo lwaki gavumenti yateekawo guidelines ezijjanjaba. Bwe guba musujja, it is test and treat. Si kugira neewuliramu, wulira ennyingo, ne appetite siina, noza kamire, bw'ogenda mu ddwaliro basooka kukola ki? Kukebera ne balyoka bakujjanjaba. Kati ebyo byonna twabikola. Era mbagambe ki? Obwo bu test kits obwo bwe twakola buwonyeza eggwanga lyaffe kye tuyita importation, oba okuyingiza mu ggwanga lyattu obuuma obukebera, obukits obukebera COVID. Tuwonyeza eggwanga lyaffe miliyoni 147. Naye bannasayansi be twakuŋŋaanya mu 2020 ne twekolera kits ezo ezikebera COVID ezaffe eza wano ku butaka, nti ensimbi gavumenti ze yandibadde ekozesa okugula ate eyingize. Bannasayansi, abaana b'oku ttaka lya kuno bannayuganda nga ggwe nange, twagenda mu laabu era ne tukola bukiiti obwo. Okitegedde? Obugalo. Ffenna obulwadde twali tetubumanyi naye twasitukiramu ng'awo tusapootinga minisitule y'ebyobulamu okutereeza okulaba nti abantu tetufa nnyo. Naye amazima abantu baabeeranga eyo nga babonaabona naye nga tetulina na bukiiti buno obutesitinga nga tebuwera, ng'era twasalawo tubeere nga tukolamu balondemu naye bwe tukulanga okolola nnyo ng'okola ki gwe covid. So kizibu nnyo okubanga okola ku ndwadde naye nga totegedde bulwadde ki. So okulaba nti tutambuzza okubaako bwe tutuuse bintu bikulu nnyo era binene nnyo eri eggwanga. So tuba tuli awo, eyo yali Maachi 2020 ne tutambuza kati ekyo gino gyonna emirimu gyatandika mu 2020 mu Septemba bwe twafuna essente ezasooka era ne Dr. Bakiro y'omu ku abo bannasayansi abaafuna ku grants ezasooka okukola ebintu bino vaccines, diagnostics ne therapeutics. So tuba tuli awo, the senior presidential advisor on epidemics ng'ate omukulembeze w'eggwanga amwambusizza eddaala n'amufuula ate minisita. Bw'amufuula minisita, akabadde ka preside kano akatono bantu 7 ne omukulembeze waffe minisita nga wa 8 kati ate nga kayina okugejja. So kwekwava gye bayita the Science, Technology and Innovation Secretariat Office of the President, STIOP. So ekyali just preside kati efuuse secretariat oba kale ezanya kapaati aka ministry. So mu bwangu ennyo wandyangu ogiyita ministry ya science ne technology naye nga etugiyita secretariat kuba ly'erinnya eryatuweebwa omukulembeze.
Tusaba abasawo b'ekinnansi otujjanjaba, tulina obwetaavu ng'ebagambye tulina emiti zitugenda ne tusima eyo mu nsiko. Tuba twetaagayo naffe butusi, twetaagayo gloves, twetaagayo n'ebintu ebirala ebitusobola naffe okukozesa, era mutusizeewo obuuma obukuuba obuwunga eddagala eryo naffe tubeere nga tufuna owangu okulabika nga tukolagana. Nze ngenda kwogerayo obugambo bubiri bwokka. Ekizibu kyaffe nze mbadde nsaba wadde ekyuma kiri wano ekikebera naye naffe tubadde tusuubira nti mwandibadde mutunulira ku madisitulikiti agali esayidi z'eyo nga waliwo olugendo luwanvu okugenda sayidi z'Embale, muntu ave Kapchorwa aveewa aje wano. So twagala tubeere nga tufunako pulaani naffe ebyuma bisembere ebisobola okusengejja porogulaamu yaffe naffe eddagala litambule. Ensonga ey'okubiri, tufunye obuzibu bungi nnyo ku bantu abasima eddagala ate nga balikozesa. Tubadde tusaba wabeerewoko at least saamusaamu embeera weebeze abantu bajje bakebere amadagala gaabwe gatandika okutambula okusingako batubeera n'amadagala gaffe eyo naye tegatambula kubeerako ne we gagenda. Twandibadde naffe tufunako porogulaamu ekola ki ebintu byaffe naffe tutambule. Abantu bali eyo beetya naye lwakuba nibaba tetulina kyakukola.
I'm from Mbale. We are tourists from Mbale. Yes, please.
Mbale rural.
As Elgon region, we have herbs, and the herbs are treating people. We fear to come in front and say, because NDA will come and say, how do you know? How do you say that it treats true? People who use it real feel relieved and they get better. But we have a problem that we cannot come and even test. Formerly we were going to Kampala. But as I talk, We are really grateful. I think you should give an applause to NAPAC. The government of Uganda has tried to come and bring the service nearer to Elgon region because they know Elgon has a lot of herbs. We are grateful for that. But as we talk, some of us have tried to come there. All of these people have herbs that are working, but they lack money to test. What I'm requesting the government and the lady from the state office, please kindly help these herbalists to at least, you say, the first 200 people should get a free testing so that we test free very fast. People don't have money, but they want to test. We are requesting that you give us a way to test okay, doctor said it's 50,000. There are people who have herbs, but don't have the money for testing. Please let the government give us some time to test our herbs freely.
No congratulations, my band. Katinga, Shadies Lonko, Madaga Wigali, Ninjagala Bategi, Muabakola Bollywood. A children Mava to Katumugami, Tulibumu, Mutulimba, in Cha, Yakuleta Galanta, or you are Satani, Gamugo, Muchilaba. I think some things are no community, you know. Okulaba and Tumulimu Mukonoga president, Chachurungi, you know. Council village, Chijakokora. Akat, National Drug also Chamber Gamba. Bade Mbasaba, Mlina Labasawo, Navaista. Mutwala Mauli, Mukama to President Atukutaka, at West Saint, Governor Mbale, Bisu Sabu region. Tunetaka Kangakumi, Susunde Dagara, Neobanga, Tunde Dagara, Mulikuimbe Dagara, Mulikuimbe Dagara. Where are you going to get that medicine? Not only not Banja, Umiaka and Letar, Dagari Mulina Jacob. Most about your Laban to Kurama again, no Kuja, Bajako the Sati, a new Mijako away.
Now I'm a senior herbalist, or senior research scientist. We have worked together with Busitema University for the last almost 4 years now. First of all, I would like to thank the government of His Excellency Dr. Museveni for remembering the herbalists or passing the law that can allow us to work. Because you find out that our people are dying, even though you take to China, even though you take to Turkey and come back, you will never survive. But we have medicines that can heal our people. So we wanted to open our people that medicines are here. In this Mount Elgon, we have a lot of medicines. There are things that can make our country even to become a superpower. Just what is in this mountain called Mount Elgon. We have herbs. If we can support these people, we have the lower Mount Elgon and the upper Mount Elgon. The herbs that we are free to get the lower part, but the side of the forest is difficult. Like now the Pruna Africana, that's our the member from the India state. In our language we call armotic. This one treats prostate cancer. So to get from the forest is difficult. So we just mark from there. If we can allow us to also give us a permit to allow us, if we want some medicine which are sensitive to the forest, for the herbalist, we can work.
I am the team lead, the pathogen economy at the Science, Technology and Innovation Secretariat at the Office of the President. Our major role as the pathogen economy under the Office of the President is to coordinate research, development and commercialization of response tools toward health threats, and these span animal, plant and human health. And these response tools are, but are not limited to, vaccines, diagnostics, therapeutics. But I would want to critically point out therapeutics from natural products. Right here where I'm standing now, we've been at the Mbale campus of Busitema University, and today, in conjunction with National Drug Authority, Uganda Herbalists Association, the Eastern chapter of the Herbalists in the country, Eastern Uganda, and of course STIOP, or Science, Technology and Innovation, Office of the President, we've hosted over 450 herbalists tackling all sorts of disease conditions. And we've had a very great engagement. They're coming from the whole of Eastern, take Kapchora, Kwen, Buko, go to Butembo, Manafa, Mbale, and all these districts in Eastern Uganda. So, majorly, we've been discussing standardization of their drugs. Now, at the pathogen economy, we are out to supporting standardization. These are products that have very, very good claims. Many have been notified by the National Drug Authority. But usually, even at notification, the National Drug Authority advises that they do more studies on, these herbalists do more studies on their products for further standardization. They advise they do some animal studies and clinical trials. Now, clinical trials are very expensive, but they also need very special expertise. And that's what the pathogen economy of Science, Technology and Innovation has come out to do. So far we've done 2 clinical trials that are multi-drug. They don't only chase one drug, and these have been in the area of COVID-19, then influenza type A and type B. And now, right now in the pipeline are medicines, natural products that are targeting diabetes, and then also malaria and painkillers, but all these herbal products. So at a go, we are able to run a number of products through our clinical trial. And next, after this tranche of support to do clinical trials, we shall be handling anti-cancers. And already we have natural products or herbals that are targeting breast cancer and prostate cancer. So that said, we today have majorly been able to tell them about the platforms STIOP has set up. We've already set up here a very huge and very well equipped hub that is for now supporting Eastern and Northern Uganda in herbal standardization. We have bulk extraction, we have an HPLC, we are able to do analysis that the herbalists have wanted to do, but I've had to travel to Kampala all the way. But now we've brought services closer to the people. So we built the building right from the ground, and now we have a 3-storied building where this work is being done. From the interaction today, we've also told the herbalists here that we actually have also animal testing services where you put their drug in animals, you expose the animals, the rats especially, and then you're able to tell what the drug will do to the body, the spleen, the liver, the heart, different organs and tissues in the body. That is something that has not been happening with most herbalists, apart from those that are working on products and are in research institutions or universities. But with our herbalists, with many drugs that have been notified and are on the market, they've not even been knowing about these animal studies that we call in vivo studies. But we've set this up for now at the College of Veterinary and Biosecurity, that is covered by Makerere University, but we're also enhancing it here at the Natural Therapeutics space here at Busitema University, the hub that we have set up as STIOP to be able to support these animal studies. And so today there's been great appreciation of what this can do. And majorly we've talked about import substitution, export promotion, and productivity acceleration. We know that with this, the drugs that are being worked on here in country will be able to go beyond the borders of this country, because we shall be having data from the clinical trials, from the animal studies, from the in vitro studies, and also from community observation. So this is what we are doing. And some of the most important questions that have been asked by the herbalists: one, they want that their drugs move alongside the conventional medicines. When you go to the hospital, you're able to make a choice, and also to have the doctors also prescribe some of their drugs. They want support to grow these herbs, to get communal land where they're able to grow. They need more support in testing, so that now if I'm from Kwen, I don't have to travel all the way to Mbale. Of course, we've lessened the distance where they've been going all the way to Kampala, but now the journey has lessened. Though now they still want us to take maybe to a region that is covering Sebei region, to be able to support standardization there.
Today we are here at Busitema University, Faculty of Health Science in Mbale, to have a dialogue between scientists and the indigenous scientists, whom we call herbalists in Eastern Uganda, to try to discuss on issues how we can work together to promote the quality of herbal medicine in this country. So we have very many, close to 500 herbalists who have come to attend this function, and we want to sensitize them about the services, the natural products, such an innovation center that was set up by the government of Uganda through the Secretariat of Science, Technology and Innovation, can help them to improve the quality of their herbal medicine. For a long period of time, there has been secrecy in the practice of traditional and complementary medicine globally, even in Uganda. This is because of mistrust or lack of confidence between the indigenous scientists or the herbalists and the researchers. Some time long ago, indigenous herbalists claimed that science should come and take their knowledge and use it to develop formula, and they benefit from them without the herbalists benefiting. However, this practice is not good, and using the framework that the STI has put up, we want to create transparency, and the president actually articulated that scientists should work with the herbal medicine along the entire journey, from the processing up to the clinical trials, to ensure that the herbalists benefit from their products. One of the major challenges that has been facing the herbal medicine sector is lack of scientific evidence to support the claims about herbal medicine. And this is where Busitema University Natural Products and Research Innovation Center comes in to do the science, to make sure that these medicines are standardized and they can be believed by even people who are practicing conventional medicine. The other challenge which has been around is ownership of intellectual property. You know, traditional medicine has IP that resides within the herbalists, but herbalists alone cannot develop this product fully. So there is need for a framework to bring all the stakeholders and players along the board when it comes to IP and benefit sharing. The challenges scientists face while working with herbalists, the first one is language barrier. As you can see here, we are translating in almost 5 languages: Sabine, Ateso, Lusoga, and so on. So the issue of language barrier is a very serious problem to harnessing traditional knowledge, and it is very complicated. The other issue is distance. Many of these herbalists stay very long distances from, for example, here in Mbale, and someone is in Ibuku. It will take a lot of money and time for this person to come. But we also think that when we form associations and we talk, there are some associations, but these associations are so limited to areas and there's no communication. So one of the ways of improving is to ensure that there's effective communication between the herbalists as well as the researchers. Climate change and the environmental degradation has caused loss of biodiversity. Not only animals, but also very important medicinal plants are getting lost. There are some plants right now that we have to struggle to get because they are soon becoming extinct. And this is very, 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 very dangerous when we are looking for new molecules in the presence of antimicrobial resistance and emerging diseases. So in order to fight the issue of biodiversity loss, we need policies to conserve the environment, but also we need to invest in other technologies such as biotechnology to be able to harvest these molecules using biotechnological techniques such as micropropagation, tissue cultures, whereas also genetic engineering.
This event is part of Busitema's strategy of partnership or collaboration. We started research projects, especially in natural therapeutics. During COVID-19, we realized that this race cannot be completed by one person, one institution, and that's why in our strategy is to have partners. Today we're having herbalists to put our heads together from the eastern region, to put our heads together to see how we can improve our herbal medicines, better quality, and be competitive to the global standards. We cannot do that alone as Busitema, as the ministry. The herbalists are the center because they are the custodians of this indigenous knowledge. They are key players. They are key players in research and moving our country forward. And that's the reason why we have each and every person and their contribution is very essential. Secondly, Busitema University believes in community. Universities are set up to help communities, to empower communities. So for this very reason, we have brought the communities closer to us. They might have expressed their anxieties about working with us. There might be differences in knowledge or level, but we work together, and we are going to put strategies on how we work together in order to build Uganda and make Uganda the best.
My name is Professor Safina Bira, the Deputy Vice Chancellor, Academic Affairs and Research of Busitema University. Today we are holding the Natural Herbal Medicine Exhibition and Workshop, and we are hosting over 500 herbalists from all over the region in eastern Uganda, and we are extremely very happy for this engagement which is happening today, because these herbalists, they have a lot of knowledge, centuries of knowledge that they have in the herbal medicine that they use in day-to-day treatment of different ailments. And indeed, we have been engaging with them so that we can transform the herbal medicine, process it, and give it value, make proper dosage, and also make different tests so that we are able to commercialize this herbal medicine in order for import substitution. As you may be aware, the government of Uganda, we are working to ensure that we reduce on the products that come into the country and be able to make our own products as a country. Therefore, today is part of the effort to bring our cultural heritage in form of herbalists and herbal medicine to come together and find strategies on how to improve our existing natural products within our community, within our environment, to to process them, to produce them, to brand them, but also to grade them so that they can be of very important to cure some of the ailments and illnesses that exist in our communities. So as Busitema, we have provided a platform for these herbalists and create a partnership to process and manage the herbal medicine through our facilities that have been installed. For the government to intervene, and indeed the government is already intervening in this call. For example, like today, this engagement, we are holding it together with the Ministry of Science, Technology and Innovation, Office of the President, who have partnered with us to bring these herbalists together so that we can sit together and tap into the existing knowledge scientifically to come up with useful products. But the herbalists, of course, require support, much more support, to help them in terms of putting their products together, in terms of packaging, in terms of supporting them in processing, in terms of doing clinical trials, and in terms of registration of their products with the URSB and other global organization, so that they can manage their patent rights, but also be able to benefit from their efforts and their intellectuals. So the government is through the Ministry of Science and Technology is working hand in hand with us through our center here to be able to reach out to the herbalists in the region, and the call is that we need to profile them so that we are able to reach out and be able to know what kind of products they are dealing with, so that we can help them.
My name is Matia Mulindwa Kagugube, the Deputy RDC of Chibuku District. Today I'm here at Busitema University of Science and Technology, where specifically we have come with the traditional healers to address the issue of the management of local drugs. Since time immemorial, our ancestors, our grandparents have been using these local drugs to address issues of illnesses. And they are very, very, practical, and they are healing. But in a way, questions arise about the dosage, about the amount of drugs one should take to make sure that they get healed. Just like you buy Panadol and you are given a given dose to heal your headache. Here, it is not so easy to determine how many kilos you will take to heal your malaria. So what the university is doing tonight is making sure that they address this issue of knowing which type of drugs, which type of element is within these drugs, and then the dosage of the drugs. I think it's the right way to go, that the government has decided to do it this way, and so that now people can be given the right doses for them to heal their sicknesses.
Patricia Kaide from Edon Farm Investments, Uganda.
What does it do?
We produce a variety of products from the natural trees around us, and at the moment we have rosemary. The product itself, it treats a lot of diseases, but in this case, since we have been told that we cannot identify the main disease that the product treats, they are asking us to take these products to the clinical laboratories such that they identify the proper diseases that they treat. But the challenges we faced before reaching this far, they were the finances. it being that you're starting from a low ground, you don't have basically the finances to buy the gadgets that you use to distill these things. It means a lot because if they take my products to the clinics, to the clinical laboratory, and they are tested, and then I'm told the particular disease that my products treat, this gives me confidence to move out here at home and even abroad, such that I sell these products at a broader market. Yes. Basically, if our medicine is tested in the laboratories, I think this will give us the ability to go out there and reach the market. But the biggest problem, like I said, is the finances, because at the moment we are producing at a small scale, so it needs us to get like more finances such that we produce at a large scale. I call upon the government, the Ministry of Health, to support us, to support particularly Edward Farm Investments Uganda, because I believe these products, if they are improved and value is added to them, they can do well. They can treat a variety of diseases without exporting drugs from outside.
My name's Lawrence Camilo Sabit. I'm from Busia district to attend an exhibition on herbal medicine. Before the coming of this NRM government, herbal medicine was disregarded. But as President Yoweri Museveni, the President of the Republic of Uganda, said in 1986 that he had come with a fundamental change. And it is true, it is a fundamental change, especially in this sphere of herbal medicine. Now, we have attended this exhibition and we have found out that many herbal medicine samples are very beneficial to our bodies and have been assessed and approved by NDA. I in person have got Gekasa herbal medicine capable of treating brucellosis and other antibacterial diseases, which has been approved by NDA. We have also learned that the government now is putting in a lot of effort to develop herbal medicine so that we can widen our market for herbal medicine outside Uganda and within Uganda. Not to forget to take the herbal medicines to required institutions such as Natural Chemotherapeutics Research Institute, Busitema University, and National Drug Authority to analyze the drugs, prove efficacy, safety, and quality of the products. And then we improve on the standards so that it can be consumed worldwide. Okay. Thank you very much. Again? My name, I remain Sabit Lawrence Camilo, a resident of Busia district and chairman of